Hello, my name is Heinrich Volmink and I'm the Executive Director of the National Division of OUTA. Access to healthcare is a basic human right which is enshrined in Section 27 of the Constitution, and we want to see universal health coverage with the widest range of health services available to as many people as possible, particularly to those who are marginalized and vulnerable. Furthermore, nobody should face catastrophic financial risk due to illness or injury. So universal health coverage is essential and non-negotiable. Unfortunately, we believe that the National Health Insurance or NHI bill in its current form is unlikely to get us there. Now, we understand the deep concerns from the public who will have to use the system, the healthcare workers who will have to run it, and to those who are worried about possible job losses in the medical aid industry. We also appreciate your concerns. But we'd like to see all of these concerns directed into constructive suggestions that will take this debate forward. Now, we already recognize some risks in the bill in its current form, and these are considerable. Firstly, there is the massive risk in trying to impose a new system on top of a broken health system without fixing that system first. There are the risks inherent to the fund itself. We've seen almost an endless list of examples of funds and entities which have been targeted for state capture. We therefore need to see a cast iron system for guarding big funds before risking such an enormous new venture. Then there's a question of the source of the funds. Taxpayers are already struggling. Much of the public concern of the bill arises from the fear that people have that they will be left with higher bills and taxes with substantially less healthcare. Healthcare workers and experts are justifiably worried about underfunded state facilities that don't have enough staff or equipment. Next, there are the concerns related to the poor performance of the NHI pilot projects. Surely we need to learn from these projects and then reassess what might work before moving forward. Finally, what is the guarantee that the NHI will indeed, in its current and proposed form, improve access for the poor? We're concerned that the centralization of the system in the NHI may in fact leave even more marginalized. So OUTA wants to see a solution that benefits as many people as possible, that does not limit patient choice, that protects jobs in the health industry, and that does not exclude the poor. We should be looking for solutions that deal with the risks we face so that we can fix the system and make universal health coverage a reality. South Africa doesn't have the resources to make mistakes. Over the next few weeks, we will consult with a range of experts and knowledge leaders to identify concerns and solutions. We'd also like to hear from the public. Please give us your suggestions. Our website is www.outa.co.za. We are setting up an NHI page on our website, and you can use the link on that page to send us your concerns and suggestions. When we've compiled our comments in the bill, we'll publish them there. We have one shot at fixing the system. We cannot get it wrong. So let's work together to fix healthcare in South Africa. Thank you.